Look, there might have been a misunderstanding. I'm presenting the erector spino blocker. It's a video alone, it's not a didactic. So, the erector spino block has its injection plane between the thoracic spine transverse processes, or TPs, and the erector spinae muscle. In adults, the TPs are located 2.5 to 3 centimetres lateral to the midline. During the survey scan, it may be helpful to first identify the ribs and pleura. The transverse processes are directed posteriorly to make way for the anteriorly placed ribs. Therefore, on a lateral to medial sagittal scan, there is a step up or change in shape at the costo-transverse junction. Alternatively, the TP and/or costo-transverse junction can be imaged in the transverse plane and the transducer rotated to obtain a sagittal image. Tilting or sliding the transducer at this point medially from the TP will image the thoracic spinal lamina. ESB can be performed with the patient placed in the sitting position, similar to that required for a thoracic epidural technique. A common needle trajectory is from cephalad to caudal with the transducer in longitudinal orientation. The needle is advanced until it makes contact with the TP. The desired sonographic endpoint is the muscle lifting off the TP. On occasions, the muscle may not lift off the process cleanly. In that case, consider advancing slightly caudal to the TP before injecting further injectate. If a catheter is used, then confirming its position is recommended. The injection plane is well posterior to the ventral rami of the intercostal nerves. Erector spinae comprises spinalis, longissimus, and iliocostalis, forming the intermediate group of intrinsic back muscles. Anterior to the erector spinae are the deep group of back muscles, including the transversospinalis muscle, and this muscle may impede anterior spread of injectate to the ventral rami from the ESB plane. In a recent cadaver experiment with dye injection, we noted extensive lateral spread of dye, which reached as far as the cutaneous ramifications of the lateral cutaneous branches of the intercostal nerves. This provides an alternative mechanism of action for erector spinae block. Thank you for your attention.
So we